Congestive heart failure. What is congestive heart failure? Congestive heart failure, as the word says, your heart is failing. There are two types of congestive heart failure. It not necessarily always means that you're dying. One type of congestive heart failure is heart failure preserved ejection fraction, where your pumping of the heart is not a problem. Your pumping of the heart is going to be perfect, but you have a problem relaxing. When your heart is not relaxing as well as it needs to, it can back up fluid into your lungs and it can cause congestive heart failure. Or the other type of congestive heart failure is heart failure reduced ejection fraction, where your heart pumping itself is reduced. It's not functioning properly. Your normal pumping of the heart is not 100%. Your normal pumping of the heart is 55 to 60%. So when you have a pumping of the heart of less than 50% and you have symptoms of congestive heart failure, then it's called congestive heart failure with reduced ejection fraction or systolic dysfunction. That's the old term which we used to use. So who are prone to congestive heart failure? People who have, whose risk factors are not well controlled. Like if your diabetes is not well controlled, your blood pressure is not well controlled, or your sleep apnea is not well controlled, you are prone to congestive heart failure. Of course, there are some unavoidable things like hereditary cardiomyopathies, like familial cardiomyopathies, dilated cardiomyopathies, which can cause congestive heart failure as well. And what are the symptoms of congestive heart failure? Symptoms of congestive heart failure are swelling in the legs. When you lay down flat, you're having shortness of breath and you have to sit up at the edge of the bed, gasping for breath. Or you have to use more pillows when you're sleeping at night. Or you're having shortness of breath when you're exerting yourself. Or significant weight gain of 10 pounds in the last 1 week. These are the symptoms of congestive heart failure. Excessive fatigue can also be symptoms of congestive heart failure. And how do we diagnose congestive heart failure? One is clinical examination. So you have to go to your doctor on time to see why you're having these symptoms. And the second thing is by an echocardiogram. Echocardiogram is an ultrasound of the heart to look at how your heart is functioning, how the valves are functioning. Because if you have a valve problem, then also you can have congestive heart failure. And once you're diagnosed with congestive heart failure, adequate treatment with medications is important, especially to take the fluid off to make your symptoms better. And the second thing is to prevent further exacerbations of congestive heart failure or to make your heart stronger, especially if you have a weaker heart. There are beautiful medications, like 4 beautiful medications, which can make your heart stronger over time. So if you think you have symptoms of congestive heart failure, please reach out to your primary care or your cardiologist.